Thank you so much, Michaela. I'm so looking forward to this interesting meeting with this interesting group of audience. My name is Najat On Saliba, and like Michaela said, I have been working on environmental problems, finding solutions to environmental problems in Lebanon for quite some time. In this particular project, I would like to put it in the context of why the idea of finding whether the omniprocessors are a good idea or a good solution for the environmental problems in Lebanon was appealing to us. If we put Lebanon in the context of the Middle East, we can see, or we have witnessed in the past years, rainy seasons that are shrinking due to global warming, meaning that the whole region is experiencing a water scarcity problem. And with that comes the great need to conserve water and to optimize recycling the most possible. At the same time, and in parallel, we have in Lebanon have been having problems also with electricity shortage. And this is due to many reasons, including the shortcoming of the government of being able to manage the electricity sector. And here comes the sewage, the idea of having the omniprocessor as a solution to the sewage problem in order for us to be able to optimize the work of the wastewater treatment plants and also try to use the output of the omniprocessor in some form of energy. And so this was the work of the contract that we got, but at the same time, we used the details that Tony is going to share with you later when we were experiencing a cholera outbreak in the country. So even though the omniprocessor itself as a technology was not found to be a great idea for treating the sewage network, we found that the data by itself was so useful in order for us to track the cholera outbreak, because we have done a great job in mapping the ground and understanding the state of the wastewater treatment plants and whether or not they were connected to the sewage network or not. So I really want to also emphasize that the cholera outbreak in Lebanon came out just because we have an infrastructure problem of sewage network being connected to the wastewater treatment plants and for the wastewater treatment plant being operational or not. A lot of funding has been channeled to the country to build wastewater treatment plants, but unfortunately, there was no standard, and as Tony will show, no standard of whether or not we need to adopt one technique. You will see that we have so many techniques that were used, and at the same time, there was little funding or little capacity building on how to operate those wastewater treatment plants. And again, this is a problem that needs to have some attentions of how to channel the funding for developing countries and how to streamline and make sure that people on the ground are able to operate the machines, the plants that are built for solutions, and how to also carve a portion for operation and maintenance. I will stop here. I just gave an overview of the situation. I think this project is, the data that was collected remains valuable for any future infrastructural problem and also any future, hope not, pandemic outbreak that is going to come from the infiltration of sewage network and sewage water into the agricultural fields and into the rivers that are considered a major touristic attraction. I will stop here and turn it over to Tony. Thank you very much.
Thank you. Thank you very much.
Thank you, Dr. Saliba. So, well, good morning, good afternoon, everybody. like Michaela mentioned, my name is Tony Habib, and I left Lebanon when I was probably 18, 19 years old, went to the United States. Fast forward 45 years, and I'm still working in the United States, but I have a passion and love for the native country. And I've been volunteering for the last couple of years in terms of sharing my expertise and making the connections, especially with the Bill and Melinda Gates Foundation and FSMA and Lebanon, and trying to solve really a global problem. It's not just Lebanon, as you may all know. I mean, it's global, but it happens Lebanon to be unfortunately the ideal sick candidate in terms of how, you know, fecal matter is destroying or is playing and destroying the most precious commodity, which is water. So with that, what we're going to talk about today is really a very interlocked, a lot of parameters. They're kind of interlocked and interconnected. And there's a lot of data. And again, being a mechanical engineer with 40 years experience, I always challenge my engineers is, look, you're going to give me a correlation, okay? I want to see all the numbers lines up, and I'd like to see the mathematical formula that describe the process or the connectivity. But in this particular case, what we're going to see is art and science both, because you have a lot of parameters or interconnected. But from my perspective, I was Dr. Saliba and the rest of the group were able to see some common denominators in here and how things are connected. But the key thing is here, what you see on my slide is we're going to see how the Syrian refugee population, along with the uncontrolled fecal matter discharge, are connected to the cholera spread. So with all that, we'll move on to the next slide. Assuming my computer wants to, so let's talk first about the cholera spread in Lebanon. So the Ministry of Health has this information, and I happened to grab the data on April 13th when I was preparing this presentation. And this shows really the cumulative infection rate per 100,000. And you could see where in Lebanon, based on the regions where the hot spots are. And cholera, yes, it's present and it's spreading, okay? Now, if we look at the concentration in terms of like a number of infection normalized, you can see the hot spots. So we know where the hot spots in Lebanon, and those hot spots that we're going to look at, and we're going to really see how do they connect with the data that we gathered under the project that FSMA granted last year. So next, so we have an idea where cholera spread is and where the hot spots are. Let's talk about Syrian refugee, because that's the other parameter that we're going to tie everything in. So, and again, as this map, as you may know, Lebanon, is hosting, I don't think we are 1.5 million, a little bit over 1.5 million Syrian refugees. Most of them, really, they're residing in informal tented settlements or low-income residential housing. And most of these settlements, unfortunately, they release their wastewater untreated directly into neighboring water sources, rivers. Some of them, they might be into latrines and or collect to holding tanks, but these holding tanks are supposed to be desludged and discharged properly, but that's not the case. So this is really has put a lot of pressure on the infrastructure in Lebanon that is already struggling and impacted the water quality overall. So again, we're going to take this slide, the previous slides, and we're going to interconnect the data together in a little bit. So now we come to the third leg of this is really the project that was funded by FSMA from Bill and Melinda Gates Foundation via FSMA, okay, which is, again, like Dr. Saliba has described, the focus was, okay, we're going to focus on rural areas. We're not going to talk about the big cities and sewer networks, etc., rural areas where residents, they have a latrine or a pit where they discharge, and collect that data, how many of them are they, etc. We'll go into that details, and then see if really can we apply a centralized processing system. And that was really the goal of the study, okay? So, before we get into it a little bit, just give you a little bit of overview about the wastewater and sanitation of Lebanon. And Dr. Saliba really described it well, but I'll just run real quick, okay? Unfortunately, even as of today, most communities, towns, and cities in Lebanon, they are discharging into rivers underground, into the Mediterranean Sea, and these effluents, they're not treated or controlled, okay? So World Bank estimated in 2010, and this is outdated data because I think we're way beyond that, but they're estimated 248 million cubic meters per year of wastewater. So the uncontrolled source discharge in Lebanese cities, you add that from the influx of refugees in Lebanon, all that, they're putting a lot of stress, and they're leading to the level of contamination of potable water in Lebanon. So the Lebanese Ministry of Energy and Water has been doing some planning and putting projects out there to really mitigate this impact on the environment, and especially the drinking water. And we'll talk a little bit about that, okay? At the end of the day, though, there are no regulations, there is no monitoring. And I think the last two bullets on the screen was, in my opinion, the demise of the Omni technology. The technology itself is solid. I'm a boiler engineer, and I know exactly how the omniprocessor works. The technology is there, but if you don't have the regulations and you don't have the monitoring, you're not going to have a full system, balanced system to make the Omni works. So technology alone is not enough. You have to have the other part to it, and that's, I think, those two where of course, besides the finance to finance any projects. All right, so going back to a little bit some background. So the Lebanese government said, look, we're going to devise our effort into three groups, called it priority 1 and 2 and 3. And in brief, priority 1 was really to put wastewater treatment plants in densely populated area, in areas where there is near watersheds. The second group, priority 2, really go to the less populated area and also put waste treatment plants. And priority 3 is really the Omni type application, go to the remote villages and put a centralized small waste treatments similar to the Omni. So our effort was around this priority 3. So when the project started, the project leader, who's fortunately not with us today because he's out of town, but I think him and I worked well enough, and I understand all the work that they've done. So what they have done is they took Lebanon that you see on the screen here, and there is 5 major provinces. And they said, okay, what we're going to do is we're going to collect villages that gives us the best statistical representation. And some places you may say not as many dots, but at the end of the day, it's still a good statistical representation, so we can collect the data we needed. And the data was really population, number of households, type of collection treatment. Is there a septic tank? No septic tank. Is a septic tank leaking? Not leaking? How often they empty? The discharge location, etc. So what you see in red in here, basically, that's the data the team went out there. And we have an engineer assigned to every region. They went out and start collecting data. So now let's talk about what we have seen so far. So we're going to talk about the each provinces in details and start connecting the dots. If you take the most somewhat northern western region, as we call it, the Al-Kar region, okay? So they went to all these villages and they broke them down into Sewage and Sewage, Sewage and Sewage. And let me explain this. So if you talk a number of villages, it's broken down in these three categories. And if you break it down based on population, the same thing. So what is sewage? Sewage meaning the government at one time went and connected the houses together, okay? But that connection, that network never went anywhere, ended up in probably in a valley or near a stream. And sewage meaning they're not connected, they have like a septic tank. Sewage and sewage, believe it or not, some houses are connected to a network, or some part of the house is connected to a sewage a network, and part of it is not. An example, my colleague, his house happened to be like 2 levels, and lower level was below the sewer network, so he was emptying into a septic tank, and the upper level was into the sewer line. Weird, but that's reality, okay? So that's basically the explanation to this, okay? But at the end of the day, gentlemen, ladies and gentlemen, what Dr. Saliba said earlier is, even if you had a sewer network to collect the wastewater or call it the fecal matter, it was not going anywhere. It's still going into the ground. It was going into surface streams. So when we look, and I hope you can see the screen clearly, I didn't have a whole lot of room, but when you look at this region and you look at the cholera, infection spread, okay, and you look at the Syrian refugee population, you may say, okay, well, Tony, come on, give me a break. This is related to the Syrian population. Yeah, there is a relationship, but also in order to really spread cholera, you have to have the means, the machine to do so. And the machine was all these villages, which really, they're not all of them, but that represents the villages that we have in Lebanon, are providing the means via, again, surface water underground. And we're going to talk about this in a little bit. So that where the connection is, okay, is having this 72,000 out of, again, 72,000 people out of this region right over here, they're directly dumping into the ground or surface water. And that's, to me, correlates well with what we saw with the spread of cholera, and along correlates strongly with the refugee population. Okay, so and I'm not going to go all the details in here, but just trying to give you the overview of what we have seen. Okay, now we go a little bit north. We see less of a Syrian population, but still the problem is still persisting in terms, most of these villages, and again, broken down into blue, red, and green, and those are, again, representing sword and sword, or mix of, which still, all the above, okay, is telling us that this is the machine that is fueling the spread of cholera. Although the Syrian population is lighter, still it is very strong, and it's only because that's the machine that is fueling the spread. We're going to continue to another region. Now you're getting closer to the Mount Lebanon and Beirut area, and the hot spot is really around Beirut. Yes, I'm not going to say we have a large Syrian population based on this map, but still, population is it's the most populated area in Lebanon. You got 1 million sword, 25,000 unsword, but again, this is all going to the Mediterranean and to streams. So, and that still correlates, with the hot spot in here in Beirut and Mountain of Lebanon. Now we move out to the most southern. Again, if I look at the spread of cholera, it's more closer to the coastal areas, and again, it's because you have more population, but still the data is still there that the team found out. Again, you have a large population of unsewered, and even the one that they have found that they're sewered, they're still not. They're not being treated like supposed to, and providing, again, the means for a contamination and pathogens to spread. the Pecan Valley. Okay, so that's one that we're going to spend a little bit of time talking about in the next few slides. So the Pecan Valley is really that's where the largest population of Syrian refugee, because it's the closest to the border with Syria, and you have two hot spots right here. And again, same story repeats, but now we're going to show the next evidence why this is really happening the way it is, and why it is related to all this untreated fecal matter that's being discharged. Okay, so the slide that you're looking at shows the drainage in Lebanon. Okay, and what we have done is we put all these dots represents the villages that we collected data from, and it shows how close they are to all the drainage. When I say drainage, I'm talking about rivers, I'm talking about streams, I'm talking about anything that carry water from the mountainous Lebanon in the valleys into the coastal cities into the Mediterranean. The slide next to it is the geological formation of Lebanon. So Lebanon has a big water reservoir, underground reservoir. We're like the Chileans. I do business a lot in Chile, and you never see rain in certain parts of Chile, but I ask the questions and they say, look, you know, we get it from the snow. So we got snow accumulation in the mountains, and the snow provides, that feeds water into our aquifer, precious aquifer. And these aquifers, you know, that's where, again, the water reservoirs that get distributed into our water sources. So the dots in red shows the villages that we visited that has a moderate karst exposure. When I say karst, think about it like an aquifer. And yellow dots in here, it shows the aquifer that most vulnerable. What do I mean by that? You know, there are certain aquifers that has a porosity that allows any contamination to get to that aquifer fairly easy. It's, again, related to the geology and the permeation properties of that aquifer. So now, if we go to the next slide, you will see where things start to really make sense in here. So you see all these dots, that's all the villages we talked about earlier that is that is providing the untreated fecal matter into the ground near the rivers. Here you see the rivers and the streams, and here you see the underground, but you could see all these yellow is the very, very restricted aquifer, meaning you should never have any contamination in this formation, because it will manifest it will soak into the ground and will really it will transmit. And now you could start to see clearly, besides the population, how this cholera spread is starting to correlate well with the untreated sour, untreated fecal matter getting into the sensitive aquifer in Lebanon. Now, the next one is, again, the gray area is the Pecan Valley. Okay, and that's the agriculture, the biggest agriculture region in Lebanon. But fortunately and unfortunately, it's really the most vulnerable aquifer, and it happens to have, again, the largest population of Syrian refugee, and you have major rivers, and again, you could see how the cholera spread is in the regions where you have this sensitive aquifer that is vulnerable to pollution, surface pollution, and also underground. So to me, when I saw these graphs, it becomes obvious to me it is not just one element to the problem. There is a lot of variables in here that is leading to call it the accelerant to the cholera spread. Yes, we could sit down in here and write mathematical equations and correlations, but to me is when I put those 3 slides together, it tells me that cholera have to have the means, and it doesn't have to be just, again, populations, concentration of folks. They got to have the element, am I properly disposing of contaminated water or uncontrolled fecal sludge being this, letting seep underground, and the formation where this seepage or that contamination is taking place. So to me, that's what Dr. Saliba and the team that we're working with wanted to show you, that the villages and the data that we collected is was valuable to us to understand how these villages that we visited, unfortunately, that where we thought that we have part of them where have the collected fecal matter was, we thought that was treated, it is not. That's the sort. And some of them we thought that yes, there is septic tanks that are being emptied and disposed of properly, but again, the combination of lack of disposal, lack of finished projects, all at the end of the day led to that dilemma that we're living in terms of the water quality and the spread of disease. One more slide for you. So there was a team in 2020 that published this paper by Leah Darer in 2020, and I have the reference in here. What they did, they assessed the water accessibility, the accessibility of water for irrigation and recreational use. And they basically counted the fecal coliforms and also the E. coli. And they put it on the map. And obviously the higher elevation has had the acceptable levels, but as the water sheds downstream, that's where the levels were unacceptable. And that was a classic for all the downstreams. Same thing for E. coli. And now, except for outliers, and these outliers, they will correspond to senior refugee population or villages that had uncontrolled discharge or the aquifer itself. But at the end of the day, the data is alarming, and it's telling us, it's time for every individual in this, in this country, with the help of the international communities, to start focusing on solving that problem. Because again, to me, water is the most, to me, is really the most valued commodity, and then we have to really, preserve that. This is my last slide, just to illustrate another type of problem. So we have a few waste treatment plants in Lebanon. But I tell you what they're doing, they're producing sludge. That's the byproduct of, treating the wastewater, and in the facilities that they're functioning, if they are functioning. But that sludge still contains pathogens. I don't believe that treatment is fully and complete. And unfortunately, this sludge is being landfilled and not landfilled in a proper manner. And it is going to be the other means for spreading the diseases. So that's another problem to be solved. And that's a classic Omni technology. Omni technology will apply directly, because these sludge comes in a concentrated form, and they probably readily, they're ready to be put into an incinerator like the omniprocessor. So I'll conclude what we just talked about, that really with the data that we collected under the FSMA grant did show that the spread of cholera in Lebanon is connected to the uncontrolled discharge of fecal matter. the cholera infection rate is also related to the Syrian refugee in some of the slide that we talked about. There is no doubt about it that an untreated fecal matter is contaminating surface water, underground water, and aiding in the spread of pathogens, fecal coliforms, and E. coli, and everything else you can think of. So yes, the FSMA grant and the data collected, basically it highlights the magnitude and the consequences of the uncontrolled discharge of fecal matter. It helps everybody understand the depth of the problem, and to highlight the need to be more proactive. And I'm one of those that I'm even contemplating leaving my current job and go in this 100%. The future, like I said, the scarcity of clean water is the biggest threat in our planet. Everybody knows that. Lebanon has, again, a large fresh groundwater reserves that is right now vulnerable to contamination and pollution. Data collection need to continue, problem identification need to happen, and finding the corresponding solutions is needed. Regulations, that is also needed, and funding. And I think when Dr. Saliba talked about the Omni kind of fell short, is really, it was regulation, monitoring, and funding, not the technology. The technology is solid. And the need for continuous support of the generous Bill and Melinda Gates Foundation, FSMA, NGOs. They're needed for developing countries like Lebanon, and we all have to play part in protecting the most precious commodity, which is really drinking water. I think my last slide here, I really, the Nature Conservation Center associated with the AUB likes to really extend its gratitude to the Bill and Melinda Gates Foundation and FSMA and their generous grant, and their assisting in helping us solve this environmental challenge. And with this, I'll close and I open the floor for any questions you may have for me or for Dr. Saliba. Thank you, and I really appreciate being a good audience, and I hope you enjoyed the material that we shared with you today.
Thank you so much, Tony. Thank you so much, Dr. Najat. Thank you for sharing your experience and your knowledge with us. And I just want to say to those joined today, if you have any useful information or insights or funding opportunities or anything that you think is helpful to the work that these two sanitation heroes are doing in Lebanon, please do reach out to them. I will drop their emails in the box. Let's see how we can work together to help the situation as well. But yes, it's question time. We have a question from Ekramol. Sorry if I'm pronouncing your name wrong. Asked, what types of measures are you taking to control the cholera outbreaks? Yes, this is the first question we have. I don't know who would like to tackle that.
If you allow me to take a couple questions, and I would upfront apologize for the noise in the background because it's lunchtime and I'm next to the cafeteria here at the World Intellectual Property Center. I want to comment on two things. I think Lydia also asked about why now, since refugees have been in Lebanon since 2011. So first of all, how do we contain the cholera? I think the Ministry of Health has done a great job, and the WHO also mobilized lots of vaccines. They rushed the vaccines and they vaccinated almost the whole villages where the cholera was sent at the epicenter of the cholera. And I think one thing that helped in one way, but of course it doesn't help in another way, is that we didn't have much rain this year. and the spread of the cholera we were able to contain it because the rivers and the streams of water were not moving fast from one village to another. So we attribute it to a little bit of a semi-drought season, and at the same time, the mobilization of the vaccines and preparedness of the hospitals that were ready to help people who were infected to be isolated and to be not definitely isolated, because it doesn't require a complete isolation like COVID, but they were isolated in terms of taken care of, and at the same time given the right instructions of how to contain the cholera. So this is from one hand, but I want to focus on the other question, which is, okay, so for containing the cholera, yes, we treated the symptoms, but never treated the source. And that's extremely important. And this means that we could have another pandemic next rainy season. It doesn't mean that the sewage network, which is the main source of the cholera, has been taken care of. So all the causes for this pandemic outbreak are still there. The second thing, why now? Why now is extremely important because of two main reasons. The first one is the economic collapse and the spike in the fuel that were used to run wastewater treatment plants. So after the fuel prices has gone up, water authorities and the Ministry of Energy and Water decided not to continue running the wastewater treatment plants. So this is one. The second one is that there is a very important problem in the Syrian refugees, because when they came at first, the government has refused to make camps with infrastructure on sewage line and water lines and everything. And so the United Nations for Refugees, UNHCR, took upon themselves to provide water to the settlements and to also suck the sewage water out. And they were doing this on a regular basis until this past year, after the war on Ukraine. The funding has shrunk a lot. And instead of providing each individual with 7 liters of water and then sucking a certain number of liters per day per individual, what happened is that they cut down this by more than 50%. And this has exacerbated the problem a lot and has created all of these consequences.
Thank you for answering that. We have another question from Seju. Actually, I think you've already addressed this. He asked, how do you confirm the cholera spread? Is it by monitoring clinical cases? Have you tested fecal samples to identify the shedded cholera?
Yeah, it was contained by health symptoms more than testing the water, because if we test the water, I think fecal coliform was going to be found everywhere. In fact, a lot of tests have been done, and 90% of the water streams are contaminated with sewage in Lebanon overall.
Wow. Are there any more questions? If anyone has any burning questions, please do drop them. Ekramo is saying you can consider awareness raising in people. And then we have another comment from Lydia saying, I believe that drought is often associated with higher burden of cholera. It seems like it could be a compounding issue for sure.
Yes, I mean, if we talk about drought, meaning reducing the amount of potable water or clean water from the rain and increasing the number of sewage water going into the water streams. I totally agree with you, Lydia, I'm sorry. But what we were saying, or what experts were saying, that because we had less rain this year, the water in rivers did not move from one village to another. And definitely, of course, it's a compounded problem, definitely. But this is what I was trying to say. But I totally agree with you if we want to talk about in terms of fecal coliform concentrations in the waters. Yes, you're right, Lydia.
Okay, thank you. If there are no more questions, we will be closing shortly. I've left Dr. Najat's and Tony's email if you'd like to reach out for further discussion. But yes, I will wait 3 more minutes. Any questions, please drop them in the box. Let's talk. Did I miss any questions?
So I wanna thank the team, of course, Tony Habib, Tony Serhan, Sami Kayed. There was a large team of engineers on the ground who did the mapping and the questionnaires and the survey and everything. This was a collective effort, and reiterate the thanks to the funders, the Bill and Melinda Gates Foundation and the FSMA. Of course, thank you.
Our pleasure. Okay. We have some people saying, oh, we have another question. Thank you, Lydia. Is fecal monitoring for shedding possible in the face of unsewaged communities?
Sorry, I did not hear the question. Tony, did you hear the question? You can go ahead and answer.
Yeah, can you go ahead and repeat it if you don't mind?
Sure, no worries. Lydia, please don't apologize for asking questions. This is what the Q&A is about. Don't worry. Thank you. So Lydia asked, is fecal monitoring for shedding possible in the face of unsewaged communities?
Yes, I mean, because if you have ensured communities that, again, in the situations where we've seen in these villages where the septic tanks are leaking into the ground, you know, collecting samples, analyzing samples, you know, to look, you know, for these pathogens. That's one way of tracking you know, the spread of disease. So to me is yes, until you have the problem solved, meaning have a centralized system to have a somewhat a scheduled emptying and these septic tanks, you have to continue monitoring. I hope I answered the question, your question properly, but definitely continuing collecting samples and data is needed, and that the problem is solved.
Yes, for sure. We have someone, you know, adding on to that, saying regular monitoring and testing is important to take the next steps. And we have a lot of other people saying thank you for this presentation. We have someone from Tanzania doing similar work, so she got good insight from that. But yes, no worry. Thank you, Najat. Please enjoy the rest of your day, and thank you again for presenting today. Thank you. On that note, everyone, I think we are drawing to a close right now. If there are no more questions, this presentation will be available in about 3 months. So we do provide recording of the webinar to our FSMA members first, and then it'll be live. But again, I left Tony and Najat's email. So if you would like to collaborate or share any insights with them, please do go ahead and contact them as well. Thank you again for joining us for this FSMA Spotlights webinar. I found this topic so interesting. We have a lot of work to do, and we need to collaborate more. We need to share information. We need to share opportunities, resources. So let's continue to work together on this thing. Thank you again, Tony, and to the rest of your team who couldn't be with us today. Please extend our thanks to them as well for the amazing work that you're doing. And thank you again for joining us today. Everyone, please have a lovely day, evening, morning, wherever you are in the world. Stay tuned for the next FSMA Spotlights webinar. Topic to be confirmed, but I think we're going to head to Uganda for the next topic. So yes, enjoy your day. Thank you again, and take care.